Welcome to What the Health? The podcast where anything health is fair game. There's a lot of garbage advice and misinformation out there that can leave you feeling stumped and stuck. Together, let's sift through the sea of BS and find the best ways to get healthy and stay healthy. Join the team as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan Turo, Angela Turo, and Dr. Riley Brown.
Welcome back, everyone. I'm Dr. Dan here with
Dr. Riley.
And we're ready for another episode. We got a couple changes we got to point out. The first one, obviously, Dr. Riley has got to support his...
Support the Buckeyes.
Penn State, Ohio State playing this weekend. It's not going to be pretty.
No.
You guys are going to crush us.
That's the hope.
The other most obvious thing that I think we have to point out is...
Yeah, we picked this.
The 1980s stash is back. The wife absolutely hates it, but this is her own doing, right? Because
Halloween.
Yeah, it's Halloween, and so she wanted us to do a whole crime scene setup. And so I was growing a beard, which she was getting okay with. But then I'm like, well, if I'm going to be a detective, I'm just going to like shave it and, go all in. And here we are. So, so anyway, but that's not what we're talking about today. We're talking about TMJ disorder. A lot of people mistakenly just call it, oh, I have TMJ.
Yes, you do.
And what's the exactly? So why don't you describe what we mean by that?
So TMJ is Temporomandibular Joint. So it's just the joint, for those of you watching, the joint right there, pretty much below the ear. It's what the jawbone is connected to the skull by, essentially. And there's a bunch of muscles and ligaments and stuff like that. And I feel like it's probably one of the most used joints by a couple of people. A lot of talking and stuff like that.
Yeah.
But essentially dysfunction is abnormal motion and stuff like that. So as chiropractors, we're hopefully looking at every joint and we see I feel like we see a lot of TMJ dysfunction.
Yeah. Oh, absolutely. A ton of it. And I think that's, it's funny because I always do a quick, internet check to see what's the internet saying nowadays about, TMJ disorder. And of course, the most common, things that you're seeing from it is, you're seeing pain, right? Mm-hmm. Pain, clicking, bruxism, which is basically you're grinding your teeth. You can get headaches from it, which can range from throbbing, dull, just nagging headaches to sharp pinpoint stabbing, even up behind the eye or in the sinus. And then, of course, neck pain, neck stiffness. So that can all be related to symptoms related to TMJ disorder. So as we always try to do is get into what is the root cause, right? So then you start looking at all the different treatments or, interventions for what TMJ disorder has. And, there's many things listed, including, just physical therapy to strengthen the jaw, realignment, different things that dentistry can do, injections. And then several decades ago, it used to be a lot more common. They used to go in and actually shave down the disc. There's a disc, a very small cartilaginous disc that's between the joint or within the joint to allow good range of motion. And they would go in and either remove it or, they would do different things to help, to theoretically help realign it. But in every case that I've seen of someone who's gone through that, again, just speaking from experience, they were the same or worse. And again, we're talking about usually it's decades later when we're seeing them and it's oh yeah, I still deal with this all the time. So, really trying to get to the bottom of it. Acupuncture was another, intervention that was mentioned. But, again, as I read down through the list, of course, chiropractic was not mentioned. And yet how many times do we see that TMJ disorder significantly decreases or resolves with adjustments and addressing dysfunction around that jaw.
I feel like almost every patient that we've had either referred to by dentists or just coming in on their own research, I think 99% of them have had an improvement in their TMJ dysfunction, and some people don't even touch the jaw. It's truly a neck and upper back issue.
Yeah.
That's kind of I think I saw where there's some postural things too that can lead to dysfunction in the TMJ joint. I think that's where chiropractic can really shine. I mean, they teach us in school though how to adjust the jaw and how to look for dysfunction and stuff like that.
Yeah. Well, and again, you can, trying to get to the source of what it is. Is it a neck misalignment, a subluxation that's causing it? And many times around the atlas and axis, which are the top two bones in the neck, if those are misaligned or they're not moving appropriately, and we have technology that can, visualize that very, very strongly, right? And if it's moving excessively or not enough, and if we can get those moving better, that has a big impact. But there are segments down in the middle neck and upper back that feed the anchor points for the musculature that's going up into the back of the head. And if those are impacting, see, you have to understand that we've talked about fascia before on the show, right? Maybe a little bit.
Maybe, yeah.
So fascia is literally the web of connective tissue that weaves everything together in your body. If you didn't have fascia, you would literally be a blob of just like a pile of, bones and muscle and organs on, we wouldn't be able to sit up. But it's literally the web of connective tissue. So if you've ever peeled a chicken breast or a chicken thigh and you take the skin off that top layer, the very, very thin white lining is that fascial connective tissue that weaves not just muscle and tendon and bone together, but your internal organs. It feeds into that. So what happens is if you have a subluxation that's locking that, middle or lower neck up, and that's then, pulling on a muscle that then starts to spasm, and then that pulls up into the back of the head, that can actually come around the side of the head. It can lead to a headache. It can lead to your TMJ dysfunction of where you're opening, and that's the one thing that's the big analysis that we see when we see opening of the jaw. It doesn't track right. It doesn't just open and close, smoothly. What'll happen is it'll typically you'll be opening the jaw. If this represents the jaw right here, and this is your TMJ, what'll happen is you'll start to open that up, and then it'll slide, and it'll cause that jaw to deviate to one side. And sometimes you'll actually see it where it moves in like this S pattern, right? So you'll start to open it, it'll shift one way, and then as you open it, it'll click back the other way. And so you'll see that S, traction movement when you're opening the jaw. So we have to figure out, is it coming from subluxation in the neck or the upper back? Or is it coming from, tight musculature? Why is that tight musculature there? We obviously have to talk about, are you grinding your teeth chronically? And so typically TMJ is not necessarily a, one practitioner, solves everything. It's typically a discussion, right? Because we have dentists, you mentioned a lot of dentists refer to us because they'll be working with patients with TMJ disorder. And then, once they get them, far along, or they've done everything they feel that they can, they'll refer to us, to help assess and analyze, and typically within a couple of adjustments, right? Is that your experience?
Yeah. I mean, I feel like very few people that we have to continually adjust the jaw. The only one I can think of is she has 2 donor discs in there from a past surgery, and she's had a bunch of work done, but I think she's the only one I can think of that I consistently have to adjust the jaw. Yeah. But I feel like the new patients that come in with the TMJ, it's 2-3 adjustments maybe, and then obviously we'll touch on it periodically, but it's not a consistent thing. Yeah. I do notice if we keep the neck mobile and they're doing postural strengthening stuff, TMJ seems to behave in a sense, but I think also there's an emotional component to it. A lot of people clench their jaw in times of stress and stuff like that. And then that leads to headaches and just kind of a snowball effect of symptoms.
Yeah. So when we're looking at trying, to address that, like you said, keeping that neck mobile, the posture exercises to strengthen, very, very important. The one thing we always tell people is get those shoulders back, because so many people come in and they've got those shoulders forward, that head forward. So sitting up, we always remind people, lead with the heart, not the head, right? They're always like this. And that impacts, that impacts everything from the musculoskeletal, neuromusculoskeletal system. So, getting those shoulders up, that head back. But But yeah, like you said, the adjustment itself is not difficult, right? It's usually we'll either, use a manual pressure and like help the jaw as it's opening and closing, or we'll use an instrument, a tapping instrument that we can literally tap, forward, backward, up or down. And, within, like you said, a couple of adjustments, it can make a massive difference. But the other thing, when we take it a step further, where we're not just necessarily adjusting, but we look at some of the musculature around there. And again, you mentioned there's so many small, musculature around the face and the skull. Three big muscles that we really look at, though, are the temporalis muscle. So it's a big muscle that fans, and it basically attaches in a fan across the side of your head. And this is the temporal region of your skull. So it fans out like this, and then it comes down almost to a point right on the front of that mandible, where the TMJ is. So, if that muscle is tight, and that is involved in chewing, a lot of times we'll find trigger points, right? We'll find, areas of sensitivity, just tiny pockets of swelling in that muscle because it's constantly been used or back and forth. And so we'll just work pressure to help get that muscle to calm down. And that, in conjunction with adjusting the jaw, makes a huge difference for the lasting impacts of that jaw, the TMJ disorder, to calm down. So that's one muscle. The masseter muscle is the big obvious one. It's the strongest muscle in the body. Lots and lots of force. That's when you see the dogs with the big jowls on the side. That's where the bite, the majority of your bite force comes from. When you're talking about animals, canines, big cats in the wild. But for humans, it's a lot of force. You're breaking up. We're supposed to be breaking up nuts and, things with our jaw, hard foods with our jaw to break that down, before we swallow. So, that masseter muscle can get very tight. But one of the missed ones, I think, are the pterygoid muscles. Yeah. Okay. And those are the muscles that kind of attach from like the middle of the face, and they're pretty deep in the mouth, and then they go out to the side. And they're more responsible for that back and forth motion of the jaw. And so they really help with that grinding motion, right? You don't just chew up and down, you chew and you kind of grind your molars together as you're, chomping down and breaking down food. And so, those pterygoid muscles, if they're, tight or asymmetrical in their force and their pulling, if we can help to get that more symmetrical, then, instead of that like clicking when the jaw opens and closes, what it'll do is it'll move much more symmetrically, to really help any of that tension and the headaches and the clicking, the popping. Now, again, as you said, the emotional component with the jaw, and the grinding of the teeth, we always talk about, you have to do things, and we have to teach you ways not to recreate the problem, right? Because if we adjust it and work all the musculature and allow that jaw to move really well, but then we're not correcting the underlying, emotional stress, then you're going to continue to grind, whether it's during the day subconsciously or in your sleep, then it's not going to get to the underlying issue, right?
Yeah, and that's, I think, a good point to say, like, it's not just a woman physician type of idea. Like, I think we do a great job with helping people, but people like grind in their sleep or stuff like that, sleep study or working with a massage therapist or something to truly release those muscles and get them to relax. So that way you're not, but then if you bring in the emotional component, like even, therapy or something like that to maybe release some of the deeper down stuff that might be showing up as TMJ dysfunction.
Yeah. Well, you just even like deep breathing, we talk about a lot. And you literally change your physiology when you're, doing, taking from a shallow breathing to a really deep breath. I thought that, I was having a conversation with my oldest son the other day, and I don't even know how we got onto the discussion, but he was talking about like, well, how does your brain work in terms of sending messages, and, you allow your body to move things, but there's certain things that, that you just do automatically. And so he like literally got to the heart of the discussion of like autonomic nerve function and, motor versus sensory nerve. So I get on this whole path of like, breaking down, like describing motor muscle, and motor, for those who are not familiar, your nervous system is basically broken down into two types of nerves, to simplify it. You have motor nerves, which are messages that go from the brain out to the body. And then you have sensory nerves, which are nerves that gather information like touch, temperature, pressure from the external environment and send them back up to your brain. And so motor is going out, sensory is coming in. And so motor then is broken down even further into, your gross motor movements, which are, muscles you have control over, right? So it's like if I tell my finger to go up, down, like I consciously have say over that. Whereas things like the contraction of my small intestine to move through food through my gut, the contraction of my stomach, the contraction of my esophagus, my glands secreting different hormones, those are all automatic, right? So that's the autonomic nervous system, still a motor pathway, but different than the conscious gross motor movements. So out of nowhere, then he's like, well, what about breathing? Because there's times when you're not thinking about breathing and you're just doing it automatically, but then I can literally think, oh, take a deep breath. And then I can, breathe more air into my lungs. And I'm like, you're freaking, he's so freaking intuitive, because he's absolutely right. Because there are, both growth, your diaphragm has both autonomic and gross, neurological attachments to it. So it is both autonomic control and gross motor control. So it's so interesting. We're having that conversation and I'm like, so literally you have the ability to impact your autonomic tone of your nervous system. One of the big, buzzwords, over the past several decades has been autonomic dysfunction, right? Or dysautonomia. And a lot of times people will hear that and it tends to be, given to people who they go to their medical professional, they've got all these signs and symptoms going on of just they can't control their temperature, their energy is always low, or they're just hyperactive and then just crash, or, they always seem to be jittery, anxious, so whatever there's lots of different symptoms associated with it. They're shallow breathers, but they'll just get thrown a diagnosis of just dysautonomia, or autonomic dysfunction. So you have the ability to regulate or help to regulate through that breathing, because there's the connection there between both your autonomic nervous system and your gross motor system. And so consciously making that effort, going back to the point here, I took a little bit of a tangent, but going back to the point of taking that deep breath and helping to slow things down, you have the control to slow that breathing down. And again, by slowing your breathing down, you're going to bring your heart rate down. And so you kind of can help yourself get into a more prayerful, meditative state if you feel like you're constantly high heart rate and anxious, forward posture and just in that fight or flight state. When you just slow that breathing down and pull that air all the way down into your lower lungs, you have the ability to control that. And so how does that relate to TMJ? Well, again, if you're just, generally bringing down, the anxiousness, the autonomic dysregulation, then, you can have an impact subconsciously on, whether or not you're grinding or just, again, you don't necessarily even have to be grinding or just holding your muscle tension, at a high level. So there's a big tangent there.
Yeah, it makes sense though, because, the same things when we adjust, the spine, it's like we get the bones moving, but we also have to work on the musculature and ligaments and stuff like that. I think for TMJ, the emotional component and the stressors I think that's a large component. Because I feel like when I catch myself in stress or driving, it's always a clenched jaw because I'm at that fight or flight, sensation. So if you can, if you are one of those that catches yourself clenching, just work on your deep belly breathing. I think that can help some of that tension.
Yeah. And so then we can take it a step further, because, if I didn't bring up our dear friend, Dr. Leslie, who, she She owns MyOway Centers in Pittsburgh here. And so basically, what she does is she focuses on, toddlers, children who are not developing their airways. And so they might not be breathing appropriately through their nose. They might not be chewing, and it's literally impacting, how their jaw is developing and growing. And she talks, how important that is, just for the overall success of breathing long-term, getting more oxygen to the brain, that oxygen to the brain, and just overall development of the body, very, very important. And so, we talk back and forth on how important it is, just like we talk about the benefit of bringing kids in to get them checked and adjusted before their spine fully matures. She talks about it from a jaw and airway perspective. If you help a jaw and airway develop through good, healthy breathing and chewing habits from the time they're young, then as they grow into adolescent and adulthood, then they're going to be set up for success so that they don't ever necessarily develop a TMJ disorder, because a lot of that TMJ can be tracked back to improper development, because it's most common in women, and especially women with narrow facies, right? So they've got, the jawbone is not as widely developed, so you're much more narrow in the face and the jaw, and that partly comes from the development, right? Yeah. And we have, we've significantly changed our food sources over the last century. We don't chew as many nuts. We don't, chew whole foods as much. A lot of things is very processed. So again, you pop it in your mouth, you crunch a chip up, or you suck on a candy, and then, or like something like a processed French fry or something. And it's just like a couple bites and then boom, you swallow it down. And so it's like, you're not even taking the time to chew and break down the food because it's not even necessary anymore because it's so processed. Yep. So that, poor developmental impact can carry over then into adolescence and adulthood because the jaw and airway is not developing properly. So again, as we always see, people who start care in their 30s, 40s, and beyond, we can track issues back into the, adolescence and before. So it's like someone starts care in their 30s, they could have a 2-decade-old problem already. And it's the same thing with TMJ. A lot of times you see TMJ start to develop in, an adolescent or right around spinal, maturity, which is around that 20 years of age. So if you're not taking care of the proper development and building a good foundation, well, now you're already setting yourself up for issues down the road. So, making sure that you look at that. So if you have TMJ and you're concerned whether or not kids or grandkids, have that, like, we strongly encourage them, get checked by a chiropractor, by someone who specializes in, the jaw and airway development, and being able to set that up and set a good foundation can go a long way, from preventing the issue from ever coming on in the first place. And so it's just a really good point to bring up, when you're looking at the development, again, because your musculoskeletal system is, growing and adapting and developing over the course of the first, 2 decades of your life. Yeah. So, if you can do things early on to make sure that it is growing and developing effectively, then you're going to prevent things down the road. So,
I think you covered it really well with that. Like, same thing again, I feel like you can always go back to the spine in terms of preventative measures, but I think anything can be prevented, and TMJ is definitely one of those. But it's just a matter of getting to the right person and getting checked and making sure you don't deal with that later on down the road.
Yeah. So if you have any questions about what you're experiencing, if you got headaches, if you got clicking in the jaw, you find you grind your teeth a lot, it's hard to open or close the jaw, hard to chew, painful while chewing, or again, headaches in the front of the head, back of the head, neck pain, tension. If you have any of those symptoms that you've dealt with for a long period of time and you just haven't been able to get to the root cause of them, it would definitely be beneficial to get yourself checked out, by a good motion specific chiropractor, where they're actually going to be looking at, motion of the jaw, motion of the spine, to evaluate, how they can get that better. So if you're not in the greater Pittsburgh region, we always say, reach out to us. We'll help you find someone in your area, that can, get you the help that you're looking for. So, that being said, I think that was a quick to the point, awesome session.
Yeah.
And yeah, we'll see you at the next one.
Sounds good.
You've been listening to another episode of What the Health? The podcast where anything health is fair game, with your hosts, Dr. Dan, Angela, and Dr. Riley. Brought to you by Chiro Family Chiropractic. If you'd like to learn more about some of the resources mentioned on this show, or you have questions about something that was discussed, please reach out through our website at www.chirofamilychiropractic.com. Remember to like and subscribe to What the Health Podcast to catch all the latest episodes and replay your favorites. Thank you for listening, and remember, we're always here to help when you find yourself saying, "What the hell?"